spine and into every organ in the body. That's your body's wiring system. So anytime you have a problem that's going on, you can go identify those circuits and figure out which battery packs won't hold a charge, and then it's fairly easy from there to figure out why you can't get well. Well, as I mentioned, each of these battery packs goes through a specific tooth. Now, because they go through specific teeth, if you have, because that gives you a problem if you have infection in one of these teeth. So if you think about this car battery here, if you get corrosion around the terminal, then it's hard for your alternator to keep this battery charged up, isn't it? Well, this tooth up here is also attached to a battery. It happens to be a muscle battery. But if it gets a little corrosion, you got the same problem. And then over time, as corrosion gets worse and worse in either the car battery or in your teeth, then it gets harder and harder and harder to keep your battery pack charged up. That's why things take some time when you get into problems with your teeth before you finally get into trouble. And then eventually the corrosion will corrode through the cable to your battery in your car, and now you've got a short circuit and your car won't start. Well, the same thing happens in the human when infection moves from the tooth itself out into the bone around the tooth. So infection in the bone around the tooth causes a short circuit, as if you have a circuit breaker that simply switches off. So once a circuit breaker switches off, obviously you're in deep trouble for that organ system, because now you don't have any voltage, just like you don't in your car. And so there are two conditions in which that happens. One is where you have a root canal, and a root canal tooth is a dead tooth. The dentists are the only physicians that think you can get away with leaving dead tissue in the body. No other doctor believes that. And if you think about it, you probably wouldn't believe it either. If your big toe dies and you leave it there, guess what happens to you?
Gangrene.
If your appendix dies and you leave it there, guess what happens to you? If your tooth dies and you leave it there, guess what happens to you? It's the only thing is that the dead tooth takes a little longer to kill you than a dead toe or a dead appendix, but eventually it will. Someone asked a question earlier, what's the statistics? In our clinic, we looked at all the cancer cases we've seen, and 95% had a root canal or an infected bone where a tooth was pulled in the same circuit as their primary cancer. 95%. So the problem with pulling teeth is that teeth are surrounded by a ligament that holds it into the bone, and what dentists do is just wiggle the tooth, pull it out, put a stitch in, quit, leave the ligament behind. And of course, if the ligament's left behind, it makes it hard for the tooth to heal, and so you end up with an abscess in the bone, and it can be there for 50 years, not cause any pain, but it certainly causes mischief because it shorts the circuit out. So then if you have infection in the bone, it often spreads and takes out the next door neighbor. So a common problem is you get your wisdom teeth taken out in high school, and then within that coming year, you begin to not function well, you can't sleep well, you can't deal with stress, you can't get up in the mornings and so forth, because that particular circuit is your autonomic nervous system, which is your body's on-off switches. So now you've destroyed your body's control panel, and then we say, well, it's just a teenager, right? No, they're acting like they are because they've lost their body's control panel. And then it spreads to take out the next door neighbor, and the next door neighbor in the upper teeth, the next door neighbor in the upper teeth are the spleen stomach circuit, which I just described to you, which is your entire endocrine system. So now you've lost your on-off switches, and you've lost your entire endocrine system, and you've lost the thinking part of your brain. Guess what? The body doesn't work very well with all of those systems missing. And it's all because you have infection where your wisdom teeth were taken out. So the issue is, how do you know that you've got the problem? Well, dentists take x-rays, but a standard dental x-ray has a resolution of 1 millimeter, so you can miss a lot. There's an x-ray called a cone beam scan that Dr. Heinz Benson, which is this guy, which has a resolution of 1/10 of a millimeter, but they're hard to read because the bone in the skull is thick and thin, and so you don't quite know whether that's a hole in the bone, a sinus, an infection, or what is it. Well, the real issue is that there's a way to tell, and that is to simply take and put your thumb to your ring finger and stretch it and you'll see you're strong, and then you take these two fingers, index and middle finger, and put it over where your wisdom teeth are and check again. If you go weak when you simply touch over there, guess what? You got a short circuit. That test never lies to you, whereas x-rays can lie to you. You just put thumb and ring finger and have somebody pull on it to teach you how strong you are. And then you use these two fingers and put over your upper and lower wisdom teeth on both sides, and then recheck. If you fail that test, you've got a problem there. Now, when you have fail that test, you don't know whether there's an emotion stuck in that tooth or if you've got an infection or both. And the reason is that emotions are stored in the body as magnetic fields, and magnetic fields like to reside within crystals, and the crystals that you have in your body are, guess what? Your teeth. So the emotional baggage that you're carrying around is stuck in your teeth, and it will short that circuit out. And I wish I had time to talk to you more about that subject, but I don't. But nevertheless, when you have a short circuit in your tooth, it can either be an emotion or an infection or both. Now, if you happen to have a problem with an infection where a tooth was pulled, it's called a cavitation. And so what the dentist does is they make a little slit in the gum, and then they simply put a little spatula in there and take out the rotten bone and rotten ligament, and you can easily see how this could cause some mischief. So that's where wisdom tooth got affected when it was pulled. And then once you clean that out, then bone looks like this. Because bone looks like that, there are a lot of places for bugs to hide. And so what the dentist must do is put ozone in a syringe, because ozone is the gas that goes back through all those nooks and crannies, and ozone will kill any bug. So they just put that little tip down in the hole, blast that full of ozone, and now it's sterile. And then they draw some blood out of your arm, put it in a centrifuge, and spin it down, and it causes fibrin to form. This fibrin contains over 100 chemicals that tells the body to heal, including the bone. So they cut a little chunk of that off and stuff it down in the hole, put a little stitch across so it won't fall out. Heals like magic. Magic. People who have this done rarely even take pain pills. And you know, most of the time when you have something done to your teeth, you're looking for the pain pills. So you must find a dentist that understands this and has taken the postgraduate education to use ozone and platelet-rich fibrin, because if they don't do that, you'll be back doing this again in a couple of years. So do it right the first time instead of having to do it multiple times to get well. Well, let's see. I have only 6 minutes left.